Good afternoon, and thanks you for joining me. My name is Corey Greenleaf, and I'm a master's student here at the University of New England. Um, Today I'm going to be talking about medical malpractice lawsuits in the United States and ways that hospitals can not only be better prepared for them, but ways that they can prevent them going forward. I'll definitely talk much more about this as we go forward, but hospitals lose a lot of money to these medical malpractice lawsuits on the daily, and it's up in the billions every year in the United States. And there's some areas that are much more prone to them than others, and certain practices that are at a higher threat to being sued by their patients, aka plaintiffs, in these situations. So we're going to dive into this a little bit, and I hope you enjoy it. Just a little bit of background on what medical malpractice is. It's defined as any form of professional negligence. Now, by that we mean any way a professional, in a sense of in a hospital, being medical, so some sort of provider, whether it be a nurse practitioner, a physician's assistant, a physician, surgeon, a nurse, a medical assistant, anything where a patient either was misdiagnosed or treatment falls below what we define as the accepted standard. Now that's a fuzzy line, and that's where lawyers will often defend in their defense cases, will often define what is considered the accepted standard. So that's something we need to consider. And just to note, many of these cases, malpractice cases in the United States especially, they involve injury or death to the patient, and those are the more serious ones. And this data was taken from numbers back in 2014. So the numbers, vary from year to year, but the majority of cases, the serious ones that cause are detrimental to hospitals and their families and patients, are just those that result in serious injury and in some cases even death. So the issue at hand, I just mentioned a little bit, but just to go a little more in depth, malpractice is, one, detrimental to patients and their families. This is a lot of stress. It's a very stressful situation. No doctor wants to misdiagnose a patient, and no patient wants to be misdiagnosed or mistreated. And in serious cases, this could be on the surgery table, where a patient goes in for a routine back surgery, and then a neuron is sparked, and the next thing you know, a patient is paralyzed from the waist down, and the hospital is out millions of dollars to this patient, with rightfully so. Certain positions, plaintiffs deserve compensation for the seriousness of the malpractice at hand. And number two, they're just very detrimental to hospitals and their providers, and this is mostly financially, but also the case of provider burnout. And if a physician makes a mistake, he or she has to live with that mistake for the rest of their lives, especially the rest of their professional career, and at most the next month or so. And in serious cases in a surgery where it results in a patient dying on the table, whether it be the physician's fault or not, physicians have to deal with that, and no rightful amount of financial compensation is going to make up for that for the family nor the physician at hand. And most physicians will agree in serious situations that they should be sued for the mistakes that they make, and that's why having the right representation for these folks matters so much. Just a little graphic here from the truecostofhealthcare.org back in 2015. We can see that the total number of paid medical malpractice claims in the United States is going down each year. I mean, you look back to 2003, and the all paid claims are going down, as well as the paid claims for just physicians only. So this is a good statistic, and I just wanted to show this, though, that this is a public health crisis at hand for physicians and other providers, but it's also something hospitals need to be aware of, that the issue is improving. And there are the data and statistics, the health informatics background on this is there, and there are things that can be done, and hospitals have the data to show that there can be, fixes to this as we go forward. Another quick infographic. I'll show you an infographic that I created in a few minutes here, but this is just one that in 2015, medical malpractice victims secured $3.9 billion in compensation, and this is just in the United States alone. Now, as you can see, 33% being the big one, misdiagnosis, and then 24% being surgery, 19% treatment, and then a couple smaller ones there. And this is just to get a better sense of where we're at, and misdiagnosis being the bigger one. And, patients, rightfully so, have the ability to sue when they're misdiagnosed, but there are issues where there can be cases brought up against doctors that are just not necessary in some cases as well, and we need to be mindful of that. So I've looked at two data sets for this project, and the first one here that I wanted to drag light of is this was taken from a 2016 study published in the New England Journal of Medicine, and this one looked this was just one of the data sets that they used, but I found this table specifically, very interesting. And I know it's small, and I apologize for that, but this data looked further into the specifics surrounding medical malpractice suits in the U.S., so it was kind of a giant study. This data was taken from 5 participating malpractice law firms in the United States, and this one ranges from data, looking at just the plaintiffs, specifically the plaintiffs, their age, gender, whether they had health insurance or not, whether they were on state insurance or not, private, and then looking specifically at the defendants. So what type of physician specialty, or were nurses higher at hand, their trainees, residents. And then we look at the actual injuries themselves. So whether there was no injury, or if the injury was psychological, or if it was a breach of informed consent, or if it resulted in death, physical injury, things like that. And then it looked even a little more specifically into the types of injuries, and then as well as the claims. So how much out-of-pocket hospitals actually had to pay and settle during these claims, and then the median. And you can see, out of court, the mean was around $462,000, and then, defense costs to legal teams, they're high. And I'll go into a little bit further in a second, but surgery and OBGYN costs being the number 1 and number 2 types. And hospitals need to be aware of these numbers, and this is why I found this issue so important. The second data set that I'm looking into for this project, this was taken looking at just data in Massachusetts. So this was taken from law firms from a 2013 study, and this looked at malpractice claims in the state, like I mentioned, just the state of Massachusetts, and it examined the patterns of primary care, malpractice types, causes, and their outcomes. So here, similar to the other study where they looked at diagnosis related, but then they looked at medication related, the medical treatments, lack in communications, violation of patient rights. So whether those patient rights would be breach of confidentiality, lack of protection of data, informed consent not being available to the patient not being aware of all treatment methods, whether, say, a physician was being paid to prescribe a certain medication when there was a better medication available for the patient to get better and the patient got worse. A lot of cases that they looked at, and you can see they looked at these were from 2005 to 2009, and roughly 100 to 115 cases closed each year, and that's a high number, and hospitals specifically need to be aware of these numbers and how they can limit, and big organizations are going to be a threat over small rural organizations, of course. Now, I want to spend the majority of my time looking at this infographic that I created, and first of all, these numbers, I just want to clarify, are taken from the past 2 data sets, and I kind of shrunk them down into some important data. So I just want to look at the types of defendants that we're seeing. OBGYN, this was specifically looking at the New England Journal of Medicine studies, but I did correlate a little bit of data together. But OBGYN being at 19% of the defendants. Now, I found that a little bit surprising because I didn't dive into this too much up until this topic up until I did this presentation, and that I found very interesting. And this kind of correlates to the plaintiffs below and being 60% female, and that kind of relates to why OBGYN, those numbers kind of go together, and we can see why that would be. General surgery being only 17%, I personally expected this number to be much higher. I was expecting this number to be maybe at 50%, whereas 17, detrimentally low. Nevertheless, terrible number to look at. A lot of mistakes happening on the surgery table. Primary care. Now, I did do a little more research into this one, and I found that, most of these physicians, the primary care, not so much misdiagnosis or mistreatment, but more so breach of confidentiality, lack of informed consent, things along those lines where physicians were being sued at the primary care level. And those were ones, believe it or not, that, physicians hospitals ended up paying the most to the plaintiffs, and those are serious cases. And, and then orthopedic surgery, and this would make sense because, foot surgery is dangerous, and it requires, for example, one foot surgery may require 20 screws, and one screw slips up and the patient's foot surgery, say, gets worse. I mean, that's prone for a lawsuit right there. So no surprise seeing that as around 8%. I would expected that to be maybe a little lower, but serious nonetheless. And I apologize, in that graph, that little pie chart, it's a little small, the numbers, but you can see the majority being physicians that are being sued, 25% being trainees, and that kind of means residents and their fellows, and then 7% nurses, which, again, did not surprise me there, although nurses do a lot of hands-on. Physicians do bear more of the responsibility, unfortunately, for them, but that comes with having the license and the seriousness along with that. Just to the plaintiffs again, really quick, 60% female, and that kind of correlates with the OBGYN being at 19% of all cases. 19% of plaintiffs being less than 1 year old, so a lot of the cases, not at the geriatric level, but at a little higher at the at maybe the NICU level, the neonatal intensive care units, and the mother-baby units and the labor and delivery units. A lot of complications kind of rise there, and doctors certainly need to be on their best behavior, and they certainly need to be aware of all cases in those situations, and that includes all specialists that are accounted for there as well. 26% being 35 to 49-year-olds, no surprise there, and then 12% being over 65 years old. Maybe a little surprising. Like I said, I expected geriatrics to personally be a little higher, but once you dive into it a little more, when you find that primary care being at the center of physicians being sued at times, that number doesn't stand out as much. Let's go over to the second side now. I found this kind of interesting. 57% of all injuries reported occurred at the inpatient level. So by inpatient, they mean in the actual hospital setting, a patient was bedded. So a little surprising there, but I guess, when you see a patient at the inpatient level, those tend to be the little more serious cases. Another little standout note I had here, New York, New Jersey, Maryland, and Maryland account for 50% of all lawsuits. Now, New York and New Jersey alone have some very, very big, prominent hospitals. A lot of physicians, a lot of practicing providers there. No surprise. Maryland may be a little bit of an outlier in my opinion, but it's really not when you think of accounting for 50% of all lawsuits in the United States. Very surprising. I expected to see California on there, but again, we'll go forward with this data because this is the collected data and this is what our health informatics generates. So how can hospitals be better prepared for lawsuits? Real quickly, I'll go into this a little more detail in a sec, but developing a strong legal team, number one. Number two, being willing to outsource contracts to better equipped firms. Number three, identifying where the majority of lawsuits are taking place and cracking down on them, whether if it's the OBGYN level, fixing it. Improving patient-physician confidentiality practices. No-brainer there, and that's my number four. Wrapping it all up here, well, where do we go? So, number one, work towards preventing provider burnout. Physicians are overworked, we all know that. Nurses are overworked, PAs are overworked, pharmacists are overworked. Hospitals doing their best to improving work at the patient-physician level and preventing this burnout is so crucial, and your providers are going to be less apt to make mistakes. Improving patient-physician relationships at the primary care level, maybe a little more friendly relationships, a little more attention, and this comes with being able to take more time spending with your patient. Number three, improving legal teams and outsourcing methods. You've got to have a strong legal team, and you have to be willing to outsource some of this competition to firms that are willing to take on the battles. And number four, identifying where the majority of claims are taking place and cracking those down, striking those down. If your surgery team is being sued 4 times a week, maybe changes need to be taken place. And, this really is it can be a public health epidemic. I think our hospitals are on the right track. Provider burnout remains the big issue here. I want to thank you all for your time, and I hope you all have a fantastic day.